The Correctional Services Department says it has recorded 15 new COVID-19 cases. 8 officials and 2 inmates in the Western Cape tested positive, and in the Eastern Cape, 2 officials and 3 inmates have contracted the virus. Now, the total number of positive cases is sitting at 336, and the number of recoveries remains at 92. Joining us to talk a little bit more about this, we are joined by National Spokesperson of Correctional Services, Singabakho Nxumalo. Great to have you. Thanks so much for joining us on the show.
Very good morning, Lynn, and thank you for having me.
All right, let's start off by looking at the increases according to provinces. Tell us, why do you think the Eastern Cape is higher than the other provinces? I think we're sitting with Eastern Cape at now 228.
You've got to look at national trends. The Buffalo City is one of the epicenters of the virus. Therefore, it is not surprising that East London finds itself in this position. And I think from our side, what took us by surprise was how quickly the virus, could penetrate East London Correctional Facility. And we managed to contain the first cases. And then it was quiet because thereafter we got 1 or 2 cases. Then suddenly we had a resurgence, which therefore said there may have been new people getting infected. There may have been asymptomatic, hence even our screening could not pick them up. But also look at the Western Cape, you have now a total of 91, which also talks to, the national trends in terms of how the virus has been spreading. But we cannot find comfort in that as correctional services. Hence, we continuously look at our processes to say, what is it that we are doing, possibly where are the gaps, and how best can we go about closing them. Hence, we've even appointed a panel of medical advisors to assist us in terms of how best we need to go about, especially where the numbers have been spiraling.
I'm going to go through the provinces one by one. We've got graphics so we can talk to them. Whether you see them or not, it doesn't matter. We're bringing them up on the screen while you're speaking. So you've spoken to the Eastern Cape and the Western Cape, which are problematic areas. Gauteng, however, is remarkably low. 13 officials, I think, and I beg your pardon, 13 altogether, officials 4 and inmates 9, and there's been 1 recovery. I've got those numbers now on the screen. But what's going on there? Why do you think this is so low?
You must look at how Gauteng has gone about closing down or targeting all the epicenters or the highly dense areas. And you look at the location of our correctional facilities. For instance, you will have 1 case at Johannesburg Correctional, and we were quickly in terms of screening and rolling out mass testing, and we've really been very aggressive in that, and we've managed to prevent any possible transmission of the virus. You also look at even in Pretoria, at Hoshimamburu, there's been only few cases, so which then does indicate to say when you have sufficient prevention measures in place and you have better overview in terms of your officials moving around, then you are able to prevent any spread which may really drain your resources. So hence we are saying, what is it that is working in Gauteng? What is it that is working, for instance, in Limpopo? And then saying, okay, in the Western Cape, you have more people getting infected outside, but where are those people and where are the correctional facilities? You find that the correctional facilities, some are located within those areas. Therefore, we find our officials residing in those areas which are affected. Then that's where the challenges are. Hence, we are saying just screening alone may not be sufficient. We need to then look at how do we then deal with other factors.
However, what about testing, though? Because we're not, perhaps you can give us that information. How many tests have actually been conducted within correctional services? Because I can imagine that also will determine how the infection rate is reported on. Because, Limpopo is very, very low. Northern Cape is very, very low. I'm going to get to KZN in a short while because there are no official figures there. So talk to me about the Northern Cape is 1, so it's very, very low. I want to talk to the actual tests that have been done. Do you have those numbers?
You've amazed tell you that we'll roll out mass screening and mass testing. And East London was one of the centers where we screened and we tested everyone there. Then after that, the situation was calm. But suddenly you have this resurgence, which then says, even how you go about testing, the responsibility is not over. You still have to do more. You go to the Western Cape, the hotspot areas, those centers, your Fortberg and we have done mass screening and mass testing, yet the numbers continue to increase, which then says, yes, mass screening, mass testing, has to be done, but over and above that, how do we monitor movement of our officials, and how do individuals take personal responsibility? Because when people continue to attend funerals and other form of gatherings, the exposure is much higher. And once one case, they call it an index, once one person penetrates a correctional facility, then you are likely to have a big spread. Hence, we said we've got to look at other means, even in terms of reducing inmate population, because it becomes a serious challenge when you have a big number of people in a small space where you can't even practice social distancing. Then the measures that you put in place are really strained.
I'll try and ask you again, the number of actual tests that have been done, COVID-19 tests on correctional service officials. Do you have those numbers for us?
I cannot give you a big figure on that, but I can say, for instance, at St. Albans, where we had one case and we had to trace direct contacts there, we tested more than 100 officials and more than 100 inmates. In East London, you have just over 3,000 officials, and all of them were tested. We are now having to retest, those officials. There was mass testing at Johannesburg, I may not have the exact figure, and also at Hoshibampuru, Bethal, and a number of correctional facilities. And thanks to the Department of Health, it's been really working well with us to say, let's roll out mass testing and let's see how things are going. But it is also a strain on their part, because they also have the population now there to roll out these tests. So we are saying, let's assist one another. Hence, we've even had to employ additional nursing personnel so that we are able, to work together and manage the legal resources that the state has.
All right. So KwaZulu-Natal, that's quite surprising, because even to Correctional Services' own admission, it doesn't feature. What's going on there?
You've got to look at the location of those facilities in KwaZulu-Natal. The biggest center there will be Durban-Westville. Durban-Westville, it's not far from Claremont, and you look at, you have any cases are around Claremont. I mean Chesterfield, yes, Chesterfield. Do you have any cases there? The cases are quite few. And where do our officials stay? A number of them stay within the correctional facility. Only a few stay in that community. Then you have a much better manageable movement. Hence, then, the numbers there we know. Thus far, we don't have any numbers. But also, how do we manage the movement of remand detainees, those that you call trial awaiting? So the lockdown by courts has also assisted us, so that we have a much efficient system how we admit people. Because what we've done is that all newly admitted persons must be quarantined for at least 14 days in our admission cells. Then thereafter, we can move them to the general inmate population. That has also assisted us in a big way. Hence, we have less numbers across all centers where newly admitted people have contracted the virus or have managed to spread the virus around. So you do have such classical cases, but you've got to really do a thorough analysis. Where is the correctional facility located? What is the infection in that particular area? You then find correlations between the two.
All right, let's move away from this issue now and talk to the release of inmates. So how's the process going with regard to gearing up to these release of what is being spoken to almost 19,000 inmates?
It's a process which will really assist us, because all experts will tell you that for you to manage COVID-19, the environment must be conducive. We find ourselves with extreme levels of overcrowding. St. Albans Medium A, for an example, only has 706 beds. But inmates there are 1,683. That's massive. You take Johannesburg Medium A, only has 2,630 beds, yet inmates there are 6,609. Can you then practice social distancing there? Almost, impossible. Hence, then the president allowed us to say, let us look at the category of low-risk sentence inmates and those who are closer to their minimum detention period. Then the parole boards must process them. So it's not a blanket release. We'll not wake up and open the gates and say 19,000 people go. We still have to go through all necessary parole processes, meaning case management committees will prepare profiles. Each and every inmate will have to be presented before the parole board. They go through each case, and then if they then see that, no, this person has been rehabilitated, the risk is quite low, then that person, could be placed out. But we are saying there are no processes that will circumvent. Victims will still have an opportunity to participate so that the process is fair. We then went further to say, but we have to do it in phases, starting with women with their babies behind bars. To say we will start with them, the elderly, and those who are sick will then move to those who have been serving longer sentences.
Right. I want to also look at the releases. Have there been any releases as yet in this crop of those that have been identified that will be eligible for parole?
No, not at this stage. Finalizing processes. Remember, due to lockdown, our parole boards were not working. Now we need to, we're getting them back. We're also looking at other viable means to contact victims, because you do not want a situation now people have to make means to travel to a correctional facility for victim offender dialogues. So we've got to say to have technology which can assist us, either by video conferencing or by telephone or people writing. So it's those modalities, but we are really racing against time. So our officials are really pushing this so that at least by the time the country reaches the peak in terms of COVID-19, at least a number of the 19,000, has already been placed out. But we are saying we do understand the pressure, but we do not want to take a risk where we release people prematurely. It will only be people who deserve to be placed out because their risk is so low. Because it will not assist us releasing a person in a matter of a few days. The person is reoffended and is back in our cells.
Are the inmates screened on a daily basis? I mean, in terms of having their temperature taken, and we've been seeing some visuals of the officials going in and making sure everything is sanitized and cleaned. And I mean, because we know that that's the thing that helps inside of anything, whether it be a school, a work environment, a prison, keeping things sanitized. Social distancing within a prison, as we're seeing in these visuals, is almost impossible. Are the inmates wearing masks? I mean, are these things all in place at the moment?
We have our own production workshops, and it's really assisting us now because inmates are able to produce their own masks. They've produced more than 20,000 masks, and as we speak, Devin Westville, the workshop there, I think it started yesterday, also to produce masks. So that is happening. But what we've done, we've given our officials tablets for screening purposes, because we realized that the manual process was just taking forever and we're dealing with big numbers. So they are using that, and the advantage is that we are able then to see centers which are really pushing screening through that particular gadget. Then it does assist when certain centers, the numbers are not moving, to say what's happening there, why are numbers not moving, so that we know exactly what is it that we're dealing with. And it's not only inmates that we screen on a daily basis. Our officials, even the service providers, come into our facilities so that we can prevent the virus from going to our centers. But when we have positive cases, how best do we then contain those cases?
Just a final question. I know you mentioned there's no one of these inmates that have been released as yet. None of them are out. What is the time frame? When is that going to start happening, the release of these identified inmates?
We gave ourselves a 10-week period, and we said we'll do it in phases. So, for instance, we already have the numbers in terms of how many women with babies are behind bars and those who fall within the appropriate categories. Also, the elderly. Well, I think we have about 3 of them, but not all of them will qualify because the offences that they committed do matter as well, and also those low-risk inmates. So, in the 10 weeks, we've got to push all those who fall within the selected categories out. If we can do it before the 10 weeks ends, that will be a plus. But the pressure is there, and we have to do it. Other than that, it's going to be really difficult to implement our disaster management response strategy on COVID-19.
I know it's pressure, but the job has to be done properly. We would hate somebody to qualify for parole and they don't deserve it and go and recommit crimes, and the family are not consulted with. So let's just hope all these procedures are in place. Thanks for talking to us. I'll have to leave it there for this morning. The National Spokesperson from the Department of Correctional Services, Singabakho Nxumalo, giving us an update on the position of both inmates and employees of the department with regard to coronavirus.